Hello and welcome back to TheLine.Info's Healthcare Corner. Today's topic isn't new, but it's deeper than most realize. Clinician burnout. We've all heard about overworked physicians and nurses due to long shifts and even emotional exhaustion. This is a very real issue for those who dedicate their lives to caring for us. Have you ever wondered how this actually affects you, the patient sitting across from them? Let's take a deep dive and explore this. My name is Joseph Arrington and I'll be your host today. I hold a doctorate in business administration, whose research focus was on organizational behaviors in health systems and physician decision-making. I am currently in joint programs for a medical doctorate and a PhD to become a physician scientist, training clinically for rural medicine and research-wise in health system operational innovations. Burnout isn't about being tired. It is a measurable syndrome. Symptoms include emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. The World Health Organization even classifies it as an occupational phenomenon, not a personal failure. And in medicine, that distinction matters. Why? When a physician or a clinician, like nurses or physician assistants, nurse practitioners, when they are burned out, they're not just losing energy. It can lead to a loss of empathy. Imagine this. A physician who used to remember every detail about their patients, now struggling to make even eye contact with them. They start dreading going into clinic, doing all they can to simply survive each shift. In this survival mode, everything becomes mechanical. The communication becomes brief, and the patient experience, it falters. There's research that was done that talks about how a physician's demeanor can affect patient outcomes. How the kids today would say vibes, the vibes from the physician, their aura, they do affect how the patient's outcomes will happen at the end of their care. So here's the paradox. Clinicians go into medicine to help people directly. That's why I left healthcare administration and paused my biotech pursuits to train to become a physician. I want to help patients in a more direct way. So what causes this paradox that I mentioned is the feeling from physicians that in the U.S. healthcare system, that things such as reimbursement models, productivity metrics, and electronic records overload, among other organizational facets, and often punish the very behaviors that these physicians were trained to know that define what good medicine is. Which are simple things: listening attentively, teaching and consulting together with the patient, and that takes time, and overall, connecting with each other. With that, have you ever been in this situation? You call in to schedule an appointment with your physician, only to hear that they had apparently retired. They have been your physician for over 10 years. The person that you told people who was your physician, who you trusted your life with, or maybe was there for you in hard times, or who delivered your children, they're suddenly gone, and they don't even give you a goodbye. You hear it from a receptionist. I posit that this happens because the U.S. health system has made caring for patients a grind. It's almost like retail work in many situations and many specialties. And the common grievances that we hear from retail workers, those professionals, we hear from physicians. I know when my family learned of physician retirements after the fact, I didn't feel like I was really cared for, and that the care that I'd received over the years had actually been genuine. I felt like I was just another customer on a conveyor belt, in and out of the hospital's doors. Now, a burned out clinician is more likely than not still competent technically. Those years of training would not automatically be deleted due to burnout. What is more likely to happen is that the clinician will be less likely to catch subtle things that can prevent medical errors. Studies have suggested that higher burnout correlates with increased diagnostic mistakes, reduced adherence to best practices, and even higher patient mortality in some specialties. This is a ripple effect coming from the burnout. So are there any solutions? Most systems might respond with an uptake in socials, maybe departmental yoga classes, free lunches, or even resilience training. And while those do help, they are simply band-aids and don't treat the cause. So let's talk about one of the causes that I believe is prevalent in contributing to the issue of burnout. And that's systems. Burnout is systemic. As someone finishing their second research doctorate focusing on health systems, and as a former healthcare administrator, this is a topic that resonates with me. One aspect of burnout could be seen as an issue revolving around what could be called moral injury. What I mean by that is we see clinicians in healthcare often being forced to choose between what they were trained as seeing is right for their patients versus doing what may be required by the system that employs them. Dr. Amir Kaisi speaks about how there are two tribes in healthcare, the clinicians and the administrators. In that conversation, for me, I see that each are trained in different ways to help improve hospitals' abilities to treat patients both directly and indirectly. The difference is in how they approach their goals. Each of these tribes, to me, causes a big part of the strain leading to the moral injury that we've been talking about. Until we address that disconnect, the gap between purpose and practice, I believe no amount of mindfulness will fix it. Let's circle back to the research we spoke about earlier regarding that direct effect a physician's demeanor has on the patient. We know patient care does not just suffer because clinicians are burned out, but it suffers because the patients sense it. They feel dismissed, rushed. And when physician trust breaks down, adherence plummets. That means more readmissions, more complications, and ironically, more work for already burned out clinicians. It's a vicious cycle, an Ouroboros even, the snake eating its own tail. So the next time you hear about burnout in medicine, don't think of it as doctors need a break. I urge you to think of it as a real public health issue. When the people who care for us lose their ability to care, we all pay the price. But what can we do if we are not policymakers? One thing is to vote for politicians who will make true change in medicine. Write to your representatives to let them know this is something that they should address. If you are so inclined and are able, maybe even run for office yourself. You can also send things to health professionals to show your appreciation. During the height of the COVID-19 quarantine, many nurses in our rural county were quitting due to the extreme demand they were feeling from the influx of patients and the increased regulations imposed on them for public safety. In a gesture of thanks to those still there, the Rotary Club I am part of created thank you baskets for all of those workers, and we delivered them to the hospital. So please consider doing something similar, as you never know how much that can mean for someone. Another thing that I am doing on the professional part of things is being a part of various organizations and joining their boards of directors to try and influence things where I can in this phase of my career. I also have plans of taking a leave of absence from medical school once my PhD and first board exam are finished to go to law school, so I can be more effective in understanding and practicing law. A major pain point I see in the discourse of physician burnout comes from the conditions of specialty training during residency. The tipping point for me was an online conversation between residents that I read, wherein one frustrated resident was nearly begging when they said, and I'm paraphrasing, "We're all the physician attorneys. There are a few who do this training, who are both physicians and attorneys. But where are they? We need them to help us. Where are they?" That stirred something in me, and I felt in a non-villainous way the following statement from Thanos fit quite well.
Fine. I'll do it myself.
If we want better healthcare outcomes, we have to take care of the caregivers. That's not just compassion, that's system design. Overall, thank you so very much for listening. Please make sure to follow and subscribe to us on our various social media accounts. Your support ensures we can continue bringing you news and information. Until next time, this has been Dr. Arrington with TheLine.Info at the Healthcare Corner. See ya.